I prepared for that, but it's still funny to hear that. But I think there is a movement happening within medicine, and the medical establishment is really awakening to what cultures have known for a long time, which is that we can't really establish human health if we're not living in balance with nature. And I'm a pediatrician, and that was a very easy conclusion for me to come to. I mean, the rates of chronic illness in children are just unforgivable, and there's kids with multiple chronic illnesses, and that is very painful for those of us who interact with it every day. But things like the pandemic really brought it to the fore for other clinicians as well, because emerging infectious diseases will only be bigger and more as we continue not being in balance. So the vision is really that healthy ecosystems have public health value, and that people need to live in nature all the time in order to be healthy. But what I do at the Center for Nature and Health at UCSF, where I work, is take all of that understanding and also all the science coming out about nature and health and try to translate that into the incredibly inequitable and highly inefficient US health system. And so it's, what we do is try to figure out how nature can enter the patient-doctor conversation in a clinic, how we can create partnerships between health departments and outdoor agencies. And most importantly, I think what we do is do research that can potentially move policy. And in the medical field, that's a randomized controlled trial. So that's what we do. So the science, I think, the compelling part about the science around nature and health that is very relevant to clinical medicine is all the work that really shows that being in nature is restorative. So there's something about the urban environment that is very taxing to our attention span, our cognitive reserves, and also seems to be kind of a chronic high cortisol ambient state for us. And when you take an urban person and you put them in nature, and some of the studies are only like 40 seconds of nature exposure, what you see is that people's memory spans, attention spans improve, short-term memory improves, they're able to have better problem-solving skills, and it's not that they don't respond to stress, but when they do respond to stress, their response is way more efficient. You see a bigger cortisol spike, and then it comes back down to baseline. And so over the span of over a lifespan, that is like a huge thing. And on a population level, that's huge, because some of the main killers of people are like cardiovascular disease, and some of the major causes of morbidity are things like depression, and those are all very sensitive to stress. But I can give you a little bit of a view of how that plays out in my clinical interactions, and I can tell you some of the people that I've done green or nature prescriptions for. And they include people like a 4-year-old who was from Yemen, who the day before I was in clinic with her had lost 20 family members in a bombing. I mean, like, what do you really give for that, right? And so I have lots of patients who have autism, and when I actually go out into nature with people, and they are so wholehearted and like just full body jumping into the bay or just like running up to animals, and their parents really describe joy without judgment in a way that is not possible in an urban setting. Or other kids, for example, I had one patient who was 2 who wasn't walking yet and was growing up in a homeless shelter. And the mom was so worried about the child making noise and so worried about being judged as a bad mother that she would often keep him in his stroller. And so he didn't have opportunities to walk and wasn't learning how to walk. And in each of these examples, the nature prescription was not a piece of paper, and it wasn't a one-time thing. It was a long-term relationship and an investment in a family. And really first of all, really working with people to help them know that they deserve to be in nature and they have a right to be in nature, and that nature is theirs. They're from nature, and it's part of what they can use to heal. And a lot of it is case management and figuring out how to fit, even rest into normal life, much less rest outside in a natural space. This question is meant to be a little facetious, but actually maybe yes, if we do this correctly. But what I do, clearly I went to medical school and I believe in medicine, and I'm definitely not anti-science. And I think that if you have a medical problem, especially if you have a child that's suffering from a medical problem, you should use whatever works. And I think that's why I feel very strongly about doing randomized trials and really creating really tight evidence, especially if we're going to ask for taxpayer dollars and state budgets to go towards something. It's really important that we prove that it works. And actually it is kind of an aside, but there are studies showing that there's a bacteria that lives in soil that's called Mycobacteria vaccae. Some people here might work with it, but it induces serotonin creation in the brain. But I think most things in nature probably have a very mild effect that is not comparable to the stronger effect of medications, but is something that you need a daily dose of. And so, yes, maybe if we are always around dirt, there may be enough of that it actually helps make us serotonin. But we need to do the research to really show whether that works or not. So nature is unbelievably important in childhood. And that's because childhood is the time when our brains develop and our bodies develop. And I spoke about the importance of nature in human resilience and how we deal with stress. And it turns out that stress is actually good, and especially for kids, it helps build grit. And stress is just life. But when there is really severe and chronic and cumulative adversity, situations like abuse or other things that a child cannot get away from and is in their home, stressors like that actually have a very strong correlation with health problems later in life. And that's a dose-dependent correlation with 9 out of the 10 major killers in society. And so helping a child deal with stress can have really big impact on our entire society. And the really wonderful thing about children is that you can balance stress with things as simple as a single great relationship with one adult. And those of us in this field are arguing that nature and access to nature is like that. It is also a relationship. It is also part of a child's community. It's also something that they have a right to in order to help manage and cope with their own lives. And when you look at how children interact with space, it is different than adults. Before the age of 5, kids don't really have a big separation between their internal world and their external world. And they become incredibly emotionally attached to the things that they see in the natural world. And I want to caution all of us that when we do environmental education or talk to kids about, impending end of the world, that age group that's really like telling them that their brother or sister or mother is on fire. That's a stage at which the connection with nature is very emotional. As kids get older, they really use time in nature as a landscape for play, and it's one of the most rich landscapes that provides an infinity of possibilities for play. And that ends up being really important for brain development and the development of relationships. And I do talk about kids and play a lot, but I want to remind us that we all need play, and probably the same things. I'm a pediatrician, so I just care about kids more than the rest of you. but I'm sure that everything I've said applies to all of us. I get asked this question a lot because I work in a low-income setting where it's extremely vibrant and very diverse, and I think most of the populations are perceived to be marginalized. And so I kind of break this question down into two parts to try to get at what is the person asking me the question thinking. And the first thing is to really point out that the evidence suggests, I mean, we did a survey with 1,000 patients and asked them if they value time in nature with their family, and 90% of people said yes. And yes, they also went on to say that access to nature is a precursor to healing in nature. And it's not just physical access, you have to feel safe and welcome in the spaces. But there is not one group of people that is saving other people by telling them how special nature is. I mean, it's really, we are all human beings on the planet, and I think it's a consequence of colonialism that some of us were torn from nature. And it is a universal desire to be in nature and also a universal pain that we are separate from nature. So we're all figuring this out together. But the second part of this question is really an issue of priorities. And we did ask in that same survey, we asked about nature in the context of other social needs that families have, like housing and access to food. And in that case, about 30% of the families said that access to nature was an actual priority. And then when we asked them to rank their top 3 priorities, about 15% said that access to nature was one of the top 3, which I was very surprised about. But I do think that any type of nature prescription program, I mean, already the word prescription can be seen as a little patronizing, but any program that invests in nature really needs to see the person as a whole and really invest in that person, and then to figure out where nature fits into their life. I think actually this has shifted. I think initially, yes, that was, I had to spend a lot of time talking to people about why nature is good for you, but I really, after the pandemic, never have to talk about that. I think the why has been solved, and now the issue is how. And that's, besides our clinical work, what we do is systems change. And I'm part of something called Healthy Parks, Healthy People in the Bay Area, which for 10 years we had collaborative work between the health officers of 9 Bay Area counties and all of the park departments in those 9 counties. And the fact that we were having those meetings was so important when the pandemic happened, because then the Bay Area was one of the first places in the nation that went into lockdown. And we immediately had a meeting with all the parks departments, and it was so helpful that the health people were able to describe that this is not just 1 or 2 weeks, this is gonna last a really long time. And the park people were able to describe how unbelievably inundated they were and how they were really on the front lines of a trauma response for the entire society. And they had so many questions like, how do we protect our own staff, and things that were really, really helpful to have that partnership. And I can't emphasize how much I feel like health is coming forward now. I mean, the state of California is paying my center to help them integrate nature into the statewide response to early childhood adversity. And so I think that why is gone, and it's really up to maybe you guys can help to figure out how to ensure that human beings are part of healthy ecosystems and that nature is part of daily life for everybody. the last speaker, I heard her saying that change is everywhere, and I think that change is really the only constant. And one thing about being a clinician is that it's very humbling. And you can have whatever ideals you want to have, but at the end of the day, you have to interface with another human being. And they either do what you recommend or they don't. And you very quickly get over like any type of judgment. It doesn't help to judge people. And you really just have to meet them where they're at. Otherwise, you're not going to get anywhere. And what I see is that human beings are dealing with a ton of change. I mean, I mentioned colonialism, and I think that we are just completely still reeling from the impacts of colonialism. And that's a big reason why we're at where we're at. My family's from Iran, and I have actually been part of experienced an actual revolution. Like an actual real one, not just I wish there was a revolution, but like an actual revolution. And my experience from that is like when change happened, it was like a river. I mean, it just was huge. And it flowed so hard and fast. And nobody had to ask anybody, nobody had to convince anybody. But what was dangerous is that there's so much pureness and desire for good in change, but it's really the people who are organized and powerful that can take it over. And again, this last year, I saw my cousins and really young girls in Iran, people that I know, willing to stand up to machine guns for their rights. And I think if you look around the world, there change is everywhere, and people are fighting really, really, really hard to survive. And I see that because I'm from somewhere where people are fighting for survival, but that's coming really soon. And the first speaker, or one of the early speakers, talked about the 60 years when that inflection point's happening, and I think there's going to be a lot of civil unrest. And I work with people, and I love humanity, and I don't judge us. And I understand that we might put off change until that inflection point. But when it happens, it's going to be a big river. And I think it's up to us in this room to get organized and to make sure that it's not co-opted and that it goes in the right direction. So I think that these conferences should really be about planning and how we're going to deal with the huge change that's coming when resources get very scarce, and to make sure that we point it in the right direction. So, but that being said, I, on behalf of children, really want to thank everyone in this room, because this work is really about survival. And I'm grateful to each of you. Thank you.